So welcome everyone to implementing a self-measured blood pressure or SMBP program in the clinic setting. And today is our first session, session 1, and we'll be focused on SMBP background. My name is Elena Smith, and I'm a quality improvement advisor with Superior Health. So today's objectives are going to be to define self-measured blood pressure, identify the benefits and uses of SMBP, and review some eligible patients for SMBP. Before we jump into all of that, I do just want to do a quick poll here just to see how familiar we are with SMBP, if anyone already has an SMBP program or anything like that. Jerry, would you be able to launch that poll? We do have 2 questions, if you wouldn't mind answering for us.
And it looks like we have our answers. Okay, so it looks like as far as having, if they refer patients to measure outside of their clinical setting, it looks like both of our participants do. And do you already have an SMB program? Both of our participants do not.
Awesome, that's great to know. So thank you so much. I know we are a small group today. We might get more people joining us in future settings, but kind of the exciting part of this is that we can kind of tailor this program a little bit more to you and make sure that we're giving you resources that are really specific to you. So with that, we do want to do some quick introductions. Today's session might be a little shorter. It won't probably take up the full hour since we are such a small group, but I'm going to stop sharing so we can call out to each of you. So I can kind of go first and do my introduction. So I'm going to ask for name, your title, and your clinic organization or location. So my name is Elena Smith. As I mentioned, I am a quality improvement advisor with Superior Health. I am personally located in Michigan, but we spread over Michigan, Minnesota, and Wisconsin. So with that, I will hand it off to Jerry to introduce herself.
Hi, and I am Jerry Henniker. I'm also a quality improvement advisor for Superior Health Quality Alliance, and I am located in Minnesota.
Great, thanks, Jerry. How about Wendy? Wendy, you are still muted if you're talking, but you can press *6 to unmute because it looks like you're joined by phone.
Okay, this is Wendy Borth, registered nurse. I'm a healthcare home care coordinator, Sleepy Eye Medical Center in Minnesota.
Great, welcome. And Teresa.
Hi, I'm Teresa Cooey. I'm a quality improvement nurse at Grace Health, Federally Qualified Health Center in Battle Creek, Michigan.
Welcome. All right, this is great to know. And you have a representation from both Minnesota and Michigan, and from our standpoint and your standpoint. So that's pretty exciting. Like we mentioned, we could get some other people joining in future weeks, but we are really excited to share this program with all of you and possibly have some future opportunities with SMBP as well. So I'm going to jump right into the presentation. So today's presentation is going to focus on the background and the purpose of SMBP. So the first thing we need to cover then is high blood pressure. So high blood pressure is a pressure of 130 systolic or higher or 80 diastolic or higher that stays high over time. And this chart here reflects the newest guidelines from AHA. So this is something we'll have all of our resources tagged at the bottom of each slide. So if you ever want to have that resource within your clinics, you definitely have access to all of those. I think Jerry put the link to all of our slides right in the chat for you. So what is self-measured blood pressure, or SMBP? So this is when a patient measures their own blood pressure outside the clinical setting, and it typically will take place in their home, and even more so now that we are living through coronavirus. So patients receive training from their clinical team on how to properly self-measure. So that includes the actual measurement itself, positioning, and any instructions that might go along with it. Patients then send those blood pressure readings and share them with their healthcare providers. That way you can kind of make some clinical inferences from them. Things like diagnosis or management of hypertension can all be controlled based on what you learn from SMBP. And we know that with feedback and clinical support, you can really have some great outcomes with an SMBP program. So what is self-measured blood pressure monitoring? We have some great graphics here over the next couple of slides. This one, self-measured blood pressure monitoring, is the regular measurement of blood pressure by a patient at home or elsewhere outside of the clinical setting using a personal home measurement device. This could be a great graphic for something in your clinic to be able to show to patients, that kind of shows what a patient is doing and how it's benefiting their lives and what you can learn in the clinic. So the summary of the evidence supporting self-monitoring, and I kind of mentioned this a couple slides ago. So SMBP, along with additional clinical support, is a proven approach to reducing the risk of disability or death due to hypertension. So some of those examples of additional clinical support include one-on-one counseling, telephonic or web-based support, or educational classes. And we'll get into some of the things that are actually available within each state that can help with this additional clinical support. Maybe you have the ability to have an SMBP clinic, SMBP program within your clinic, but you might need some additional help with that clinical support. And there are some opportunities that exist that can help with that. And then finally, why implement an SMBP program in your practice? So we know that hypertension is very burdensome. So 1/3 of Americans aged 18 and older are hypertensive, which is 72 million adults, and nearly half are not under control, which is 35 million adults. So if we're able to kind of find a program like SMBP that we can implement and get patients engaged in, it can kind of help get that under control area far less. There are tons and tons of resources for SMBP. It is something that is kind of cutting edge at this point in time. There are resources in Spanish, there are great videos, and these are just a couple of them that exist. This one on the left is a one-pager that's great to just explain what self-measured blood pressure is to a patient. The one at the top here on the right, that's from a video that exists. That's about 2 to 3 minutes that goes over the exact process of measuring at home. And then here at the bottom right is just an example of one of the Spanish resources that exists. So what are the overall benefits of SMBP? There's more timely and precise initial diagnosis of hypertension. So if you send a patient home with a device, you have a better idea of what's going on at home, and you can kind of determine if it is hypertension or if it's something like white coat hypertension, which we will get into. It provides reliable estimate of effectiveness of antihypertensive medication treatments and allows for accurate titration of medication when needed. So if you need to adjust any medications, you can easily see what's going on with the patient at home when they're outside of the clinical setting. It can help confirm elevated office readings. So maybe it isn't white coat hypertension. It is truly that the patient is hypertensive, whether they're in the office or at home. It can help differentiate between white coat and sustained hypertension, and it can detect patients with masked hypertension. So some other reasons that there are benefits to SMBP: it gives you a better understanding of the patient's medication need, whether they are using it appropriately, if the dose is correct, and things like that. It can help assess control of blood pressure at different times across a 24-hour period, because you are asking the patient to measure their blood pressure in the morning and in the evening. It can decrease the resistance to treatment because the patient feels more empowered to be more involved in their care and to self-manage. Again, you're sending them home with this, you're teaching them how to measure their blood pressure, and they're seeing what their blood pressure is at home. It improves access for those with barriers related to receiving healthcare. That's a huge one right now, that SMBP can be used during the pandemic because patients are doing it at home. And then improvements in systolic blood pressure and diastolic blood pressure and mean blood pressure. And down here at the bottom is just an example of some of the evidence that shows that SMBP is beneficial. So in a 527 patient trial, home blood pressure monitoring plus self-titration and telemonitoring cut average systolic blood pressures by 12.9 millimeters of mercury. Another benefit to SMBP is that in 2020, January of 2020, so just about a year ago, a list of current procedural terminology codes were released that include SMBP. We will get in a little bit more depth with these two codes at future sessions, but codes 99473 and 99474 are used for SMBP monitoring. So not only will it help you track your SMBP patients that you apply these codes to, but there are opportunities for reimbursement with both of those. One of them is $11 and some change, and the other one is $15 and some change. And those are definitely things that you can use to your advantage to improve your SMBP program over time, maybe make the choice to invest in some monitors, knowing that you'll get some of that reimbursement through Medicare back. And again, we will definitely get more in depth with CPT codes at future sessions. So now let's get into which patients benefit from SMBP. And this can be pretty broad. So the first is patients with a diagnosis of hypertension. So this helps with increasing engagement and adherence to treatment or improving their blood pressure control. They can assess the effect of treatment on blood pressure control, which includes that adjustment of their medications, and then finally determining whether the treatment-resistant hypertension is present when blood pressures are difficult to control. On the flip side, patients without a diagnosis of hypertension or those who are at risk of hypertension can also definitely benefit. So patients with elevated office blood pressures who are suspected of having hypertension. So if you want to send them home with this, with a device to track their blood pressure, you might be able to make that diagnosis based on what you see happening at home. Patients with suspected white coat hypertension. So white coat hypertension is where people exhibit a blood pressure level above normal range due to anxiety experienced in the clinical setting. So here are some of those guidelines that would help you understand if you're looking at white coat hypertension. So a systolic blood pressure of greater than 130 millimeters of mercury, but less than 160 millimeters of mercury, or a diastolic blood pressure of greater than 80 millimeters of mercury, but less than 100 millimeters of mercury. So again, you send that patient home with a device and you see that their levels at home are much lower than when they're in the office, and that could help you identify if your patient has white coat hypertension. On the flip side of that, you can also identify if a patient has mast hypertension. So mast hypertension is the opposite of white coat hypertension, where the patient's blood pressure reading is within normal range in their clinical setting, but higher when measured at home. So this would look like a systolic blood pressure that's consistently 120 to 129 millimeters of mercury within the office, or diastolic blood pressures that are consistently 75 millimeters of mercury to 79 millimeters of mercury. So sending a patient that's not diagnosed with hypertension home with a device can help you identify if your patient falls under one of these two categories. So just to kind of sum that all up a little bit, so patients that benefit from self-measured blood pressure include those who have uncontrolled hypertension, newly diagnosed hypertensive patients to see maybe better understand what kind of medications they need to be on, dose, and things like that. Patients with potential undiagnosed hypertension, hypertensive patients with medication adherence challenges, and then finally hypertensive patients with office visit barriers. And again, that's a huge one right now, especially since I know there's a good portion of the patient population who still aren't comfortable with going into office settings always. The opportunity to be able to track their blood pressures from home is a great benefit to an SMBP program. So that's kind of the end of our our didactic portion of today's presentation, I am going to share this document that we created that will be helpful for action planning within your clinic. So let me get this up. So you'll see here, and we will send this out to all of you in an email. This is our SMBP action plan. So this plan is to serve as a guide that will help you work your way through this SMBP training, and kind of at the end, you'll be ready to start an SMBP program. Each week we'll kind of assign really quick homework. It's more of a decision making than actual homework, but then we'll kind of report out at each next session. So for example, for week 1, this week you learned about SMBP, who benefits from SMBP, and who is eligible to self-measure their blood pressure. And the following questions are the first step to success in your SMBP program. So you want to identify clinic champions. So clinic champions are the staff members who would provide the main support for your SMBP program. They'll be able to answer questions and disseminate new information about SMBP to other staff members. So we always suggest having kind of 2 people that are super knowledgeable about SMBP that can kind of help answer questions. If you get new staff onboarded, they'll be able to kind of bring them up to speed and things like that. So one of the homework assignments for next week would be to identify who those 2 staff members would be. Who are you targeting for SMBP is the other piece of this. Are you going to be looking at one patient population to start? Maybe your uncontrolled hypertensive patients. This is a good one that a lot of people choose to start with, because if you get more of those patients in that controlled range, it helps your quality measures. But there are a lot of different options that you can focus on. You can focus on several of these at the same time period, but here are just some ideas to start with. And then finally, another great step would be to, if you've chosen one of these, to pull that list of patients to get started. So that way you can kind of identify the patients that you would enroll in your SMBP program first and go from there. So I, again, will be sending this out to all of you so that you have access to this. This is a great thing if you are part of a larger health system that oversees a lot of clinics. This is a great thing to walk your individual clinics through. They can have access to this. Each week you go through different steps. So how will you enroll patients to SMBP? Who will train the patients? These are all things that we'll be getting into each week. How will you talk to patients about getting involved in your SMBP program? How are you going to use the home blood pressure monitors? I have a couple examples of some monitors that you'd be able to purchase, and I'll show you what you would do when you have those monitors. Preparing to start your SMBP program, how would you get the blood pressure readings back from the patients? So all of these things are just things to have in place before you start your SMBP program, so that you can follow this as kind of your policy for SMBP. So with that, I know we have another participant, so I'm going to stop share. I'm going to, Jennifer, I know that you joined after we did our introductions. Do you want to do a quick introduction and let us know who's joining us today and what organization and state you're from?
Yep, sounds good. Sorry about that. So Jennifer Jurdy, I'm the lead RN navigator from Ridgeview Clinics in Minnesota.
Awesome. Welcome.
Thank you.
So we did record this training. So that was kind of the end. Today's was pretty short. Other weeks could be a little bit longer based on the content that we're going to discuss. We do want to just kind of open it up to all of you now that we kind of see who is joining us today. What kind of things do you want to gain from this training that we can kind of tailor our future educational opportunities or our educational opportunities for SMBP towards? So I know this is going to be a 6-week session. We do kind of have it mapped out, but if there are additional things that we could be researching for you or educating you on, we can definitely do that. I personally lead a cohort of clinics in Missouri on an SMBP program. So I definitely have a good knowledge base of how things go for them, what things they're struggling with now due to COVID and all of that, I'm prepared to educate all of you on over the next several weeks. But I'm really interested to hear what types of things you're hoping to gain from this training and make sure that we can kind of include that moving forward. Does anyone have anything like that?
I was going to say too, only for Jennifer, we had some polling questions at the start, just wondering if they have a SMB program in place at their clinic, or if not, if they refer to other clinics or other agencies for that.
We do not, no, and we don't refer out for it either. So a lot of learning for us.
Yeah, I think it can definitely be a really successful program. Patients seem to typically like it. Again, you're teaching them a new skill and they're able to go home and do something that can help them identify things like, am I on the right type of medication or the right dose of medication? And am I seeing the same results in the clinic as I am at home?
Mm-hmm.
And Teresa and Wendy, I believe that you both said that you do refer patients to measure outside of the clinical setting. What does that look like for you?
I guess I misunderstood the question. I don't think we refer out. Is that what you mean, to another agency?
Yeah, so sometimes like YMCAs have programs or things like that.
Okay, yeah, we do promote the YMCA program. Our home care agency that we work really close with has some home monitoring programs, so we do that. Just internally, we do give out meters, but we don't have any kind of program. So I'm here to kind of look at what it would look like staffing wise, cost wise, vendors, or things like that.
Awesome. That's good insight for us to have. And we'll make sure we touch on each one of those things to kind of give you an idea of timing. How much time does this typically take to teach a patient how to self-measure within the office and things like that?
Mm-hmm. Billing would be another one that we're interested in.
So kind of talking a little bit more again about those CPT codes and what you need to make sure you're doing to be able to get the reimbursement for those?
Correct, yes.
Anyone else have any insight on like the types of things you're hoping to take away from this?
Hi, this is Wendy. I guess what Teresa said, I very much agree kind of with all of the above, kind of looking at that. And I probably didn't understand that first question either. We really don't outsource our blood pressure people. We just have them come back, encourage them to take their blood pressures at home and bring those results in. And that's about all we do right now. So, yeah, would like to make a little bit more robust program.
Awesome. That's great to hear that you each kind of are doing some sort of self-monitoring at home for your patients, but it's not as
formal or anything.
Formal. Yes. Perfect. Yeah, that's great to know. I think that this program can definitely give you some insight on what a process would look like. And especially this action planning document, it can really help map out what your plan is. It's something that you could share with staff to show them what your plan is. I think we definitely have some opportunities to integrate SMBP into your current hypertension protocols if you have that. So whether that be mapping out where this program fits in, if you do have a patient that would be going down your hypertension protocol flow and things like that. So it's really exciting. I'm looking forward to continuing to have like discussions like this. It's a benefit of having a smaller group is that we can really make sure that we're doing everything we can to answer all of your questions and researching what we can provide in future sessions. So continue to feel free to let us know exactly what you're looking for within these sessions, and we can tailor our future education to that.
And I just wanted to add to that, and you may have covered this in the first 15 minutes that I missed, so I apologize, but I would be interested in hearing these blood pressures, if they would be reportable in some of our quality metrics and how that process would look.
Yeah, definitely. So things like the quality payment program.
Yeah. For us specifically, it'd be Minnesota Community Measurement. So just any sort of programs where we need to report our patient outcomes, is this a vital sign that could be reported?
Great. Yeah, we can definitely look into that too. So that's exciting for us to be able to make sure that what we're providing all of you is exactly what you're looking for. So again, whenever something like that comes up, feel free to let us know. That's what we're here for. And we can definitely look into things like that for you and make sure that we're including that information in our sessions.
Perfect. Thank you.
And Jennifer, I did mention kind of earlier on that this one is going to be kind of a shorter session. The other ones will be a little bit lengthier. We may not always take up the full hour just based on the content that we're covering and what type of discussions we're having at the end. But we will kind of at the beginning of each session start out with a quick round robin based on that action planning document that I'll send out and just go over what each of your plans might be. So if you've kind of had the time to sit down and say, okay, I'm going to be the clinic champion, which typically it's the person that's joining these sessions. But again, we will have all of these recorded. So you could send these on to any other staff members that might be included in that clinic champion role, or deciding who you're targeting for SMBP, just letting us know kind of what your thought process was and why you want to target those. And then if you were able to pull a list of patients at this point in time. It's not a requirement. It's just kind of a good step to take when you're going through this action planning document. So that's kind of how we'll start out each session, is just going over that action planning document and then going right into the didactic presentation. Are there any other questions for today? Okay, well, if you do think of anything over the next week, feel free to shoot either Jerry or I an email, and I'll include both of our emails in the follow-up email I'll send that includes that action planning document and a link to the slides. But until then, we will catch up with you all next week, and we look forward to it.